In this section of the DVD, I'm going to be talking about scanning ovaries in the non-pregnant uterus, and we'll cover the following topics: Mare reproductive anatomy, how ultrasound works, basic scanning procedure, the equine estrus cycle, follicles, ovulation and uterine edema, CHs and CLs, uterine fluid, and endometrial cysts. The entire reproductive tract sits on top of the digestive system, which for purposes of this diagram has been removed, but when present, elevate the entire reproductive tract up near the spine so that the horns are located near the rectum. The ovaries are actually located near the kidney or at the point of the hip near the hollow of the loin. When inserting an arm into the rectum, one of the first structures that is seen on ultrasound is the bladder, which is located directly below the vagina. The uterine body is located at the front or in front of the bladder. Next, we will see the uterine horns, followed by the ovary. The oviduct, which is shown here in this diagram, is enlarged and is actually too small to be seen by ultrasound. We'll now move from this diagram here over to this diagram here, which is an aerial view of the mare's reproductive tract. The rectum lies over the top of the mare's reproductive tract, and for purposes of bringing clarity to this diagram, it has been removed. When inserting an arm into the rectum, the first structure that you see is the vagina, followed by the uterine body, and then the uterine horns. The points at which the uterine horns come off the uterine body are called the bifurcations, this being the left bifurcation and this being the right bifurcation. The uterine horns in this diagram are shown in a T position, but oftentimes the uterine horns are rotated upward in a Y position, which will become important when we talk about scanning for ovaries. Recall that the reproductive tract is suspended by the broad ligament and sits loosely on top of the digestive system. Also, the oviduct, which is seen here in this diagram, is not seen by ultrasound, and the ovary is located a short distance from the tip of the uterine horn. These two anatomical features often make it challenging to find the ovaries. Next, I will talk briefly about how ultrasound works. This is a linear rectal probe, and contained within this probe are piezo or piezoelectric crystals. These crystals resonate at a particular frequency and emit ultrasound pulses. They display a cross-sectional image of reflected pulses on a video screen, much like live black and white TV. If all or nearly all of the pulses are reflected, the image appears white on the screen, and this is indicative of solid materials such as bone and tissue interfaces. If none of the pulses are reflected, the image appears black on the screen, and this is indicative of many fluids such as follicular fluid, embryonic fluid, blood, and some uterine fluids. All other degrees of reflection appear as some shade of gray and include most other tissues such as uterine, ovarian, and muscle tissue, and some fluids such as equine urine and some uterine fluids. The white, black, and gray aspects of an ultrasound image are often referred to as grayscale. These two images on the screen will be used to illustrate this concept. On the left is an embryonic vesicle, and on the right is an ovary with multiple small follicles. In the image on the left, the embryo in the center of the vesicle is gray, and the fluids associated with the allantoic and yolk sac are black. In the image on the right, the fluid of the follicles is black, and the ovarian tissue between the follicles, as indicated by the red arrows, is gray. Our next topic is the basic scanning procedure. Although relatively easy to explain, it will take a number of hours scanning a number of mares to develop proficiency. This first diagram is an aerial view of the reproductive tract. The rectum lies over the top of the reproductive tract. As you are inserting your arm into the rectum, the first anatomical structure that will be visible on ultrasound is the bladder. It will help you identify and locate the uterine body, which you will follow to its anterior or front portion. When reaching the frontal portion of the uterine body, rotate the probe either to the left or the right, follow that horn up until its termination, then rotate up a bit further to find the ovary. After having fully scanned that ovary, follow the uterine horn back down to the uterine body and then rotate up the opposite horn to its termination point, and then rotate a bit further to find and scan the other ovary. This second diagram is a rear view of a common positioning of the uterus and the ovaries. Notice that the uterus is hanging in a U shape, with the ovaries located at the 9 and 3 o'clock positions. However, since the reproductive tract hangs loosely from the broad ligament and sits on top of the digestive system, the uterus and ovaries can actually be found in a variety of positions, with the ovaries located anywhere from the 12 o'clock to the 6 o'clock positions. Thus, locating and finding the uterus will be your best guide to the ovaries. Since the rectum hangs loosely from the spine, it can be moved from one side to the other so that you can follow the uterus to the ovaries. Next, I'm going to talk about the equine estrus cycle. In the top portion of this slide is a diagram of the cycle. Estrus averages 5 days in length, with ovulation occurring on either the day before or on the last day of estrus. Diestrus averages 16 days in length for a total cycle length of 21 days. On the bottom portion of this slide is a chart that lists the averages, common ranges, and most frequently occurring values for estrus and diestrus and the total cycle. The averages that were illustrated in the diagram above are listed in the first line: 5 days for estrus, 16 days for diestrus, and 21 days for the total cycle. The common range for 90% or more of the mares is 4 to 10 days for estrus, 13 to 18 days for diestrus, and 19 to 25 days for the total cycle. Notice that the common range for the total cycle length is not simply the addition of the estrus and diestrus values. 4 plus 13 does not equal 19, and 10 plus 18 does not equal 25. The reason for this is that mares with shorter heats tend to have a longer diestrus, and mares with a longer heat tend to have a shorter diestrus. Thus, there is some compensation going on. In terms of the most frequently occurring values, the most useful numbers are in the estrus column, with 80% or more of the mares being in heat from 4 to 8 days. Older mares tend to have longer heats. In this next chart, we'll look at some norms for follicle growth and ovulation. In the first line, follicle growth rate during estrus, the common range for increase in diameter is 3 to 5 millimeters per day. The actual range can be anywhere from 0 to 10 millimeters per day. However, it is important to note that mares tend to be similar from cycle to cycle. In the second line, the size of the follicle at ovulation for single ovulations. The common range is from 35 to 55 millimeters, and the actual range can be up to 75 millimeters, and ovulation of follicles less than 35 millimeters is rare. In the third line, the size of the follicle at ovulation for double ovulations, or in other words, the ovulation of 2 follicles, the common range is 5 millimeters smaller, ranging from 30 to 50 millimeters in diameter. The actual range is up to 65 millimeters in diameter, and the ovulation of follicles less than 30 millimeters is rare. In the fourth line, the size of the follicle at ovulation for large mares, such as draughts, thoroughbreds, and warmbloods, the diameter of the follicle is about 10 millimeters larger than for medium or small mares. In the fifth line, the size of the follicle at ovulation during summer, starting at about mid-June, the diameter of the follicle at ovulation is about 5 millimeters smaller than the mare usually ovulates in winter or spring. Next, let's look at some terms that are commonly used to describe follicles. First, MSF, or multiple small follicles, describes the presence of several small follicles less than 20 millimeters in diameter. MMF, or multiple medium follicles, describes the presence of several follicles 20 to 30 millimeters in diameter. A dominant follicle, or dominant follicles, are follicles greater than 30 millimeters that normally proceed to ovulation. They are usually evident on the first or second day of estrus. Lastly, an anovulatory follicle is a dominant follicle that fails to ovulate. There are 2 commonly used methods for measuring follicles. The first is the greatest diameter, for example 48 millimeters or 4.8 centimeters. The second method is by measuring the greatest width by the greatest height, for example 42 by 38 millimeters or 4.2 by 3.8 centimeters. using the greatest width by the greatest height is advantageous for follicles that are not round in shape. Ovulation is determined by a follicle's disappearance. It is usually not possible to witness ovulation as it occurs because most fluid is evacuated from the follicle within 5 minutes. You would need to ultrasound a mare at 5-minute intervals in order to observe ovulation. This slide illustrates the two ways of measuring follicles. On the left is the greatest diameter, in this case 41.9 millimeters, and on the right, the same follicle, 41.9 millimeters in height and 39.6 millimeters in width. Uterine edema is when the endometrium or lining of the uterus becomes filled with fluid during estrus. This edema is quite evident on ultrasound. Also referred to as endometrial folds. The edema increases during the first few days of estrus and then decreases about 1 to 2 days prior to ovulation. Mares tend to follow a similar pattern from cycle to cycle. A simple scoring system can be used to record the changes observed in uterine edema during estrus. In the scoring system I use, 0 represents no edema, 1 slight edema, 2 moderate edema, and 3 maximal edema. This first set of ultrasound images illustrates maximal edema of the uterine horn on the left and the uterine body on the right. Red arrows have been placed on the images to indicate the areas of edema. Notice that the edema looks a bit like the slices of an orange that has been cut in half, particularly in the uterine horn. This next set of images illustrates minimal edema. Again, red arrows have been placed on the image to indicate the areas of edema. Notice that no discernible pattern of edema is evident and it appears more like dark splotches. This final set of images illustrates no edema, which is characteristic of diestrus and the non-pregnant uterus. There are several clues to impending ovulation that are evident when examining follicles and the uterus during estrus. Individually, none of these clues regularly result in a high degree of accuracy in predicting ovulation. However, taken together, they increase the odds and thus, as a group, provide a more powerful tool for predicting ovulation. This is particularly true once the normal pattern for the individual mare has been established. One clue is follicle size. The maximum diameter of a follicle is reached the day prior to ovulation and is often consistent from cycle to cycle. A second clue is follicle shape. Roughly 85% of the time, the follicle changes shape from round to ovoid the day prior to ovulation. A third clue is the thickness of the follicle wall, which is maximal about 2 days prior to ovulation. A fourth clue is follicle consistency. Many follicles will become softer the day prior to ovulation. The follicle is often large enough to be easily felt just beneath the probe. By pressing a finger into the wall, you can feel if the follicle is softening. Normally, a follicle is firm like an apple, but the day prior to ovulation, the follicle can soften to the consistency of a bruise on an apple. A final clue is uterine edema, which, as previously discussed, decreases 1 to 2 days prior to ovulation. This set of ultrasound images illustrates the change in follicle shape that often occurs prior to ovulation. On the left is the typical round shape of a dominant follicle, and on the right is the change to the ovoid shape that occurs the day prior to ovulation with a frequency of around 85%. Following ovulation, the empty cavity of the follicle may fill with blood and form what is called a corpus hemorrhagicum, or CH for short. The CH is a blood clot that forms from the bleeding of the vessels in the follicle wall when it breaks down during ovulation. Approximately 50% of ovulations result in CH formation. The CH is non-functional and does not interfere with the cycle. Thus, the only significance for our purposes is recognition when scanning a mare. Another body that forms after ovulation is the corpus luteum, or CL for short. This body always forms after ovulation, and if a CH is present, will eventually displace most, if not all, of the CH. The CL remains throughout diestrus in the non-pregnant mare and persists in the pregnant mare. It produces the hormone progesterone, which takes the mare out of heat and is essential for the maintenance of pregnancy. In this set of images, a CH is pictured on the left and a CL on the right. Red arrows have been placed on the images to indicate the borders of each structure. Notice that the CH is a darker gray and even black in areas, while the CL is a lighter shade of gray. This second set of images illustrates the variation that occurs in the appearance of CHs. In the image on the left, notice that the lighter areas of gray seem to divide the CH into several substructures. In the image on the right, the CH is more uniformly dark with limited areas of gray. Sometimes a CH can be mistaken for a follicle, but when both are imaged clearly on the screen, a CH will almost always have some gray within, while a follicle is almost always uniformly black. The brightness of a CL will change throughout diestrus. Following ovulation, the CL is very bright, appearing a light shade of gray and sometimes nearly white. The size of the CL is very similar to the size of the follicle prior to ovulation. The brightness decreases through the first 6 days of diestrus, becoming a darker shade of gray. This darker shade of gray remains throughout most of the remainder of diestrus. The CL becomes brighter again during the last few days of diestrus. It will appear as bright as the early CL, but the size will be significantly smaller. These changes in the brightness of the CL are due to the amount of blood flow to the CL. The darker gray indicates greater blood flow, and the brightness at the beginning and end of diestrus is due to less blood flow. CL brightness and size can be useful in determining whether a mare is in early, mid, or late diestrus. Early diestrus mares are not responsive to the use of prostaglandin when short cycling a mare. Also, if a late diestrus CL is present, you can be sure that the mare is likely to return to heat within just a few days. These two images contrast the early and mid diestrus CL. On the left, the CL is a lighter shade of gray, and on the right, the CL is a darker shade of gray. Frequently, the mid diestrus CL can be difficult to identify as the shade of gray is nearly identical to that of the surrounding ovarian tissue. However, when the probe is moved over the ovary, the border of the CL will usually become evident. In the image on the right, the bottom, top, and right border is evident, but the left border is not clear. When scanning the uterus, uterine fluid may appear black, gray, or cloudy. The volume of the fluid may range anywhere from very little to massive. When the volume is small, the shape of the fluid is often elongated, irregular, and mobile. The presence of fluid often indicates the need for veterinary assessment such as a uterine exam, culture, treatment, and flush. My experience with very small amounts of black fluid, however, is that most mares have cultured clean and there has been no effect on fertility if left untreated or if cleared with an injection of oxytocin. The exception to this would be mares that have a history of uterine issues. This set of ultrasound images contrasts a small amount of fluid on the left with a more moderate amount of fluid on the right. The image on the left illustrates the volume of fluid that I was referring to earlier, where I normally leave it untreated or clear it with an injection of oxytocin. Cysts within the uterus are commonly referred to as either uterine or endometrial cysts. These cysts are fluid-filled structures on or within the lining of the uterus, which is called the uterine endometrium. These cysts are not a health risk, but may interfere with the establishment of a pregnancy. Usually they are few in number and thus do not present such a risk unless they are located primarily at one or both of the uterine bifurcations. Uterine cysts are more common in older mares. Sizes ranged anywhere from 3 to 48 millimeters in one study. Their location can occur anywhere within the uterus and may appear individually or in clusters. Their shape can be irregular, oblong, or round, and they are not mobile. The problem with round cysts is that they can look just like an embryo. Thus, it is important to conduct a pre-breeding ultrasound exam of a mare to identify and map the presence of any uterine cysts. A hand-drawn diagram can be used to indicate the location and size of the cyst. Alternatively, an ultrasound image of the cyst can be saved, downloaded, and printed for inclusion in the Mare's ultrasound record. If multiple cysts are present and impede a conclusive assessment of pregnancy, then the Mare can be examined again after 20 days for the presence of an embryo within the embryonic vesicle, or after 23 days for the detection of a fetal heartbeat. In this set of ultrasound images, a cluster of cysts is presented on the left. Notice that none of these cysts would likely be mistaken for an embryo. However, in the image on the right, both of these could either be cysts or embryos. Actually, the one on the left is an embryo, and the one on the right is a cyst. In this case, the identification was made easy because the Mare's cyst was previously mapped during a pre-breeding ultrasound exam.